I'm Dr. Rick Greene from the UVA medical class of 1970, and it's my great pleasure to host this series, which really highlights our wonderful faculty at the UVA School of Medicine. And today I'm especially fortunate to be with Dr. Dick Guerrant, who actually was a student when I was here. He's from the class of 1968. Dr. Guerrant is the Thomas H. Hunter Professor of International Health. He's also the director and was the initial director and the founding director of our global health program here at the UVA School of Medicine. So Dick, it's a pleasure to have you with us.
Rick, thank you. It's a pleasure and an honor to
Thank you very much.
see this series. It's fantastic.
Well, good. I'm glad you had a chance to look at it.
People like John Owen, Muncie Weavy, all the way through to George Craddock.
Wonderful,
classmates.
wonderful. So let me ask you, you went to Davidson College, wonderful pre-med institution. What brought you to the university from Davidson?
Interesting question, Rick. It's very simple. David Deck. David came down and was interviewing Davidson students for medical school. But in fact, I had met David through my uncle John Guerrant, who was here, and I asked David where are the better opportunities for colleges to get into medical school, because I always was going to be a doctor. I'm a pretty dull guy, right? Grandfather was a remote first pediatrician, and I never thought about anything else. My father was an architect, and he cured me of that with the, I think it was Boy Scout mechanical drawing merit badge, but I've never even thought of anything else. And David said, well, of course, Davidson would be a superb liberal arts college. He had gone there and knew whence he spoke. But then David came down and was interviewing, and I was looking at maybe 2 or 3 places. My father said, well, Hopkins is Hopkins a little better? It's 5 times as expensive than a UVA in-state student would be. And I said, well, Dad, it's back then, I wouldn't say this now, but back then it was a little better, but not 5 times better, Dad. So,
Where did you grow up?
Roanoke.
That's right, in Roanoke,
Yeah.
Virginia. So
Yeah.
you knew the university, you knew
Yeah.
the culture and the
Yeah.
history of the university. And of course you had family members
Right.
who had come here. But then you left after medical school, you went north.
I did. I had not been on an airplane until after my 3rd year of medical school here, when my wife and I headed off to the Congo. That's another story we may or may not get to, but never really recovered from that. But in the process of that and because of it, Cal Cunin, who was here, was telling me about options and places. So I learned about Boston City Hospital, the old Harvard service there.
Right.
DuPont Gary, the stellar superstar in our class, valedictorian and all that stuff, I guess. And I both matched there. And I was terrified because I knew DuPont would set the world on fire, and I was scared to death. But we did okay. They even took a couple of good UVA folks after that, so we must have passed their test. But,
And you decided to come back.
well, not before I had also then committed. It was during the Vietnam era, and of course
Yes.
we were all seeking a Berry plan if
Yes,
we could be so
yes.
lucky. And that summer after my 3rd year of medical school, I had gotten a Public Health Service Commission that was guaranteed to work in the Navajo Nation, which would have been fantastic. But the night I was finally about to not send it in, my wife said, oh, you've done it this far, send in this SmithKline French thing to go to the Congo. Well, lo and behold, we got that. We ended up doing it. A local church group sent Nancy because it wouldn't be my way, and she had to stop her job, on which we were both dependent. And so came back from that, though, and Cal Cunin again said, well, you're interested in international health, aren't you, Dick? Okay, if you say so. didn't think so, but
He had a
I
way
didn't
of-
know it.
He had a way of saying things like that.
He understood me better than I understood me. And he said, well, he has this friend of his in NIH, John Seal, working on cholera, and he has a program in Dakar. And I thought he was talking about Dakar, Senegal, so I wrote Dr. Seal, who had a very gracious moment that his assistant in the office, Doris Parkinson, got him in a good mood. I sent back, yes, Mr. Guerrant, you're asking about cholera program. We do have one, but it's not in Dakar, Senegal, in Africa, where you said you've been. In Africa, the continent, and want to go back. He said, this is in Dhaka, which is in East Pakistan, it was then. And if you look at your map, that's nowhere near Africa. And I said, that's even better, we've never been there. That influenced me, and those then were the 4 years that I was after medical school, 2 years in Boston City Hospital, and then what would have been 3 years in Dhaka. Got evacuated after only 1 year in the midst of a war, after cyclones and other.
It's amazing how serendipity plays a role in our lives,
Yeah,
isn't it?
that's right.
Of course, you gravitated to an infectious disease. I mean, and your whole interest was enteric problems in children and diarrhea, infectious diarrhea, and this is, I mean, it was a natural.
Well, probably not. My poor mother kept asking me for many years when I was going to do something that she could tell her friends about. And a diarrhea doc, you know, isn't exactly what she had wanted to tell her friends. I was supposed to be a pediatrician. Well, I learned in secondary medical school here that I love kids, they're amazing, but I'm not good at dealing with sick kids. And I'm better at talking with old folks that that can understand that I am not going to be able to cure all the problems. And so I shifted to medicine with my emphasis then. But infectious diseases, I never really thought about. But I was in the Congo, there were obviously a lot of them. And then in the Dhaka experience, doing research on cholera, one does need, I think, a really good excuse to be a diarrhea doc. It's disgusting. But it's fascinating, it's amazing, it's the world's biggest health problem, maybe, because there are long-term consequences that are exciting us now to try to understand and perhaps do something about. So I kind of bumbled into it, to be honest.
It was a good bumble.
Well, that's proved to have fed my children, and you're absolutely right.
Well,
An incredible ride.
You've been recognized, I mean, by so many things. You've been awarded the Thomas Jefferson Award here at the university, the highest award that we can give. I mean, obviously you're a very humble person. Tell me about the Center for Global Health, though. What was the impetus of really forming that?
Well, you know, Rick, we had, in working in Brazil from actually the mid-1970s, and then Ed Hook got us to the northeast of Brazil, where it was more tropical, and he wanted us to sort of develop more tropical medicine things. And so we, in fact, Ed got Norm Knorr and then subsequently Bob Guerrant, all of our deans, I think most all of them, at least three Carson, have been there. And when he got Norm down there, he talked Norm into, we perhaps ganged up on Norm to support a student scholarship. And so I was spoiled from '77 till 2001 by the cream of the crop third or fourth year medical students who were interested in global health, which started to burgeon over this period. And in 2001, I was on John Castine's commission on internationalizing the university by 2020 or whatever it was. And it was Brantley Womack in the history department who said, Dick, I've heard you talk about global health. You have to provide these awards across the whole university, not just in the medical school. I said, Bradley, I said, I'm spoiled by the cream of the crop of medical students. I'm probably not very good with students who aren't incredibly intensely committed to what we're trying to do. He says, oh, well, but you have to do it. Well, you learn that you have to do what Bradley says. So in 2001, we became one of the first trans-university schools, our centers for global health. And the undergrads and the architecture and engineering students, I shouldn't say this in the metal I'm building, are as good or better. They're more creative. They're really amazing young people interested in global health.
But you were able to create this working group, which really extended outside the university also.
Well, it does, but our real focus has been to try to build the sort of early childhood, underclass, what he says, early life experiences, which I would count my medical school experience, they're life-changing with seeing what the world out there is like now. Students have already been 10 more places than I had ever been before I saw an airplane, but, God, I saw them. But that opportunity, though, for our, not only medical students, but engineering students, the first group that went, I remember, a medical student went with 2 law students and an engineering student to Limpopo province, South Africa. The law students were working on the water rights in the Limpopo watershed. And oh my goodness.
A true multidisciplinary approach.
And they learn from each other.
Absolutely.
As we must, if we're going to.
Now, I know you've transitioned the directorship to one of your proteges. Yeah. Tell me what you're doing now. What really interests you on a daily basis?
Well, one of the things that I probably treasure the most is being able to pass an occasional baton to better people. And Becca Dillingham is clearly an incredible person who does the trans-university, cross-disciplinary thing with global health better than I ever could have dreamed of doing. And she's a real superstar. And like you said, this morning there were programs going on over in Newcomb across the whole university that are just fantastic and are burgeoning in popularity and hopefully influence.
You still like to travel as much as you have in the past?
I love traveling. One of my tasks is, and it's a part of an answer to your question, Rick, is cutting back on that. I'm focused actually much more now on traveling gotten harder, we have amazing colleagues and collaborators in Brazil, South Africa, London, just to name the 3 that I've been in touch with this week. But we're focusing more on the laboratory support for that here. So I have transitioned initially after having been chief president of medicine with Ed Hook and loving clinical medicine for a career. Stepped back from general medicine and infectious disease consults, and even then the Travelers Clinic, about 5 years ago now, and 5 or 6, and passed those batons to more able young stars, but have had the luxury I never expected of being able to focus full-time on research, which is directly relevant with some models now in mice and animals in the laboratory of the very problems that we're most interested in the children. And so that going back and forth with the incredible opportunity that science brings to the table these days, microbiome, the metabolome, we're starting to understand diseases like we never dreamed of.
Even in surgery, we're understanding the microbiome.
Yeah.
I hope that you've been able to transition this excitement into the medical students today.
Well, that's my job.
Yes, yes, because I think you're clearly the example of what not only global medicine can be, but what being a doctor can be. It's such a pleasure to talk with you. We've been talking to Dr. Dick Guerrant today, who has been the founding Center Director for Global Health here at UVA. He's a Thomas Jefferson Award winner. We could go on forever, but Dick, thank you for being with us.
Thank you so much. What a
Appreciate it.
pleasure.